Man on Med, April 13th, 2020. So what is going on in New Mexico with COVID-19? Let's find out. You understand and agree, nothing in this talk is medical advice. Nothing is authoritative. All opinions are my own, represent no official statements. Remember, most of the time I don't know, and often they don't know. We're dealing with a virus that has only existed for a few months in humans. These are all best guesses. If you think you have or might have COVID-19, call your doctor or the New Mexico Department of Health Coronavirus Hotline. If you're watching from out of state, check with your own state health department. This is the graph we're going to look at, and it looks a little busy, but I'm going to explain it all to you now. First, let's look at the dates. It starts on March 11th, 2020, and goes to about the end of April. The scale is very important. It's what's called a log scale. Notice that it goes 1, 10, 100, etc. This allows you to see the rate of change when the numbers are small, but also the rate of change when the numbers are very large. On April 13th, we had 1,345 cases in New Mexico. The blue dots represent actual detected cases. Remember, testing was not widespread. This does not represent infections, only detected cases. You could probably multiply these numbers by 100 to know what was out in the community at the time. The red dotted line is a projection of exponential growth if we had not done the shutdown, if the governor had not done the shutdown. Blue dotted line is the current projection if the cases continue to grow exponentially. The green lines represent what happens if our efforts for social distancing are successful in bending the curve, meaning flattening it downward. What does that mean in terms of numbers? If we had stayed on the original trajectory, we would have had 100 or 200,000 cases in New Mexico by the end of April. If we stay on the current curve and it remains exponential, we might have dropped that down to 50,000. If this curve is indeed flattening, that final number at the end of the month could be 7,000, 8,000, or maybe down to 5,000, from where it would have been in 100,000. This also affects deaths. It takes about 2 weeks before deaths start being reported, but as you can see, it just follows the same trend. So if we decrease the number of cases, we will decrease the number of deaths. By the way, I'll have a separate video explaining how to look at death, things like case fatality ratio, death rates, things like that. In the next few weeks, we still expect a surge. It would be great if it stays in the green dotted line, but we can expect it right now anywhere in that entire cloud. The problem is, if we get cases that go above that green line, our current healthcare system will not be able to take care of everyone. This only applies to COVID-19 cases. There are still heart attacks, car accidents, and everybody else that needs to be in hospital. If we get to that top peak of the cloud, many people will suffer simply because of a lack of resources. Finally, I wanted to dispel a myth that I keep hearing. Everybody can get COVID-19. Senior people may have a little higher risk or a very high risk. That doesn't mean that seniors get it. Everybody gets it. Children, adults, seniors, we all can get it. And since maybe up to half of us might have the virus but not know we have it, we are all potentially emitters of the virus. So stay home, save lives. Thanks for watching, and stay tuned for more.